well, joining us to take a look at the situation in England. Dr. Esien Ukorebi, GP Registrar, Worcester Royal Hospital, England. Thank you for joining us on the programme.
Thank you very much.
So over the weekend, the UK says it's drawing up plans under which people will not be legally bound to self-isolate after catching COVID-19. I mean, what does this mean, especially for the UK?
In the last few days, we've heard the Prime Minister and essentially the UK government say that they are reviewing plans to remove restrictions that were in place for the COVID-19, of which one of them was the compulsory self-isolation of everyone who has tested positive, to COVID-19. And that isolation period is considered to be not effective at the moment. And come March, it should be taken out. At the moment, it is mandatory. It is a government regulation. And as you correctly said, there is a fine of up to £10,000 for people who defy that rule. But what it means moving forward is that we will get to a point where people would no longer be bound by these rules, but we would have what the government calls some government guidance, where people then take the decision whether or not to self-isolate after testing positive for COVID-19. So that simply means that I could test positive for COVID-19 today and I decide to go into work tomorrow. That's what it means. And of course, the other side of it is that we will then have lots of positive cases mixing with, should I call it, negative cases, and we stand a risk of another surge in cases should this happen. But of course, we can't tell, and we believe the Prime Minister is working with advice by scientists, but that's the plan at the moment.
Dr. Ukorebi, some scientists are warning against downgrading the laws to reduce the spread, saying, it could hit pressure on the NHS. Yes?
Yeah, that's absolutely true. It is a valid concern by scientists because it is a risk that the government is preparing to take come March. And as you know, with risk, it can actually go either way. So it can turn out fantastic and be a good plan. But of course, it can also, backfire and take us back to square one. And we understand and we appreciate that the plan B, which the government set up previously, which involved, of course, wearing face masks, social distancing, working from home and self-isolation, has shown some success. As we've seen in the last couple of weeks, that there's been a 50% reduction in terms of infection rate and hospitalization. I believe these are the figures that the government is working with at this time. But of course, it is a risk, and there are lots of uncertainties surrounding this decision. Uncertainties like new mutations, so possibilities of new mutations like the Omicron coming up again, possibilities of more virulent viruses or variants of this virus, possibilities of a surge, of course, in positive cases in the country if these restrictions are completely removed. And of course, this would then lead to a pressure in the NHS and doctors and nurses and health workers struggling again. These are the concerns that the scientists have. And that's why they say it's important to review this and see if this is the right time to actually, take off all of these measures.
Also, I mean, Mr. Johnson, facing the greatest pressure of his premiership, if we would call it that, over the Downing Street party scandal, essentially, how have people been reacting to it? And do you think that this would also keep people in terms of, whatever rules or measures the Prime Minister comes up with in future, that they will really listen to him?
I mean, without going into much political detail, it is clear that rules were broken at that time by the Prime Minister himself, who set down these rules. And of course, these issues are still under investigation as we speak. But I think, people are tired of, getting leaders give them rules. And of course, the leaders don't live by these rules. We've seen, a couple of top government officials here in the UK resign for not following their own rules. And I think that's why the Prime Minister at this point is facing a lot of heat and people calling for him to resign because he set rules that he, in fact, himself did not follow. But I would say that whatever comes from the government, I think the people would follow it.
We appreciate your time always on the programme. Dr. Esien Ukorebi is the GP Registrar with Worcester Royal Hospital, England. Thank you for joining us today.
Thank you, Millicent.